My name is Kelly Covich, and I am a nurse. I'm a team leader in a 2 OR surgery center, Quad City Ambulatory Surgery Center, and I am over the pre-op area, the PACU area, and the post-op. We opened in 1992, and we have been co-owned, half hospital and half physicians since the beginning. We primarily do orthopedics, but we do also podiatry, and we also do pain management. We have been using HST since May, just this past May, so just a couple months, but we do use practice management, eChart, Clarity, and we also use case coordination. And we went live with everything all on the same day. Well, for us, the product that we were using currently was called Vision, and that was where we did all of our scheduling. And for us, the software costs were going to go up because of the interaction with some of the other products that we needed to use in order to do business. The costs were going to go up because of Vision interacting with all these other things. And then just in general, we were really ready financially, and everyone was on board to kind of get more up to date and be off paper charting, just get that communication better. There's lots of pain points with paper charting that, as everyone knows, and we were experiencing those too, a lot of staff time, effort, miscommunications, missing the chart, just having that one very physical piece that you had to keep track of and trying to make sure it was complete and together from the beginning to the end. It was just a major pain point. Day-to-day prior was just paper everywhere. We just had so much waste. Looking back, we see how many times we may have printed something just for it to be thrown away minutes later. So much time wasted trying to find that piece of paper that the one thing was written on, so you would walk all over and it would just take a lot of time. But day to day, it would be like that. I mean, just really fragmented. And like I said, lots of miscommunication because things weren't in the chart or you couldn't find that certain piece. One problem with Vision, though, was that we could only have so many users in the program as we had paid for the license. So we had only 12 people could be in it at a time. And after time, we'd have it for so many years, you forget who actually has that license and is using it. So when we would reach 12 and that 13th person went to go log in, they couldn't. So you'd have to go find someone to log off. So that was very frustrating. A lot of repeated tasks is what we also kind of can look back on and see now, like how many times did we write out their allergies? How many times did you write out their meds? Even just their blood pressure, we were writing it in 3 different spots. We didn't need to do that. We chose HST because it just seemed to be the whole package. Everything from the case coordination with the TVs, we really wanted to implement that with the texting. Patients, they expect that now. They're looking for that, and they want that TV for that communication for their families when they're in the waiting room. So that was something we really wanted, the ability to schedule and have that talk to. Case coordination was really huge for us. And then the e-charting to add on. Clarity became available as we were in the implementation process. So that just was a no-brainer for us to go ahead and add that on as well to keep improving the products we were already using. So it seemed like every time we were able to add something, it just made sense to just better use the one product you were going to get. It just seemed to exponentially help everything else. Our administration was able to go to them with some rough cost estimates, obviously, about what we're currently doing versus what we could be doing. And I think we are saving money, and it's just comparable. And to have the patient satisfaction be better because they know we're using this. There's less errors being made. The communication, like I keep saying, is so much better between patients, families, and then our team members as well. Also, we were able to do a site visit to another facility and just to see it in action. I think the owners felt like we really knew what we were talking about when we said that this was the product for us. That was really great. And just the great reviews that we've seen about HST. The communication, like I keep saying, is so much better. We have a more complete chart, I feel like, because we were addressing things that we weren't necessarily addressing on our paper charting that we were missing and just didn't even think about it. So I do think the chart is more complete. It is done faster. I can see very quickly running reports if we're missing op reports, if we're missing lab results. And so we're able to get in touch with those doctors, get in touch with the lab to get those back quicker. And so then we're able to drop charges so much faster. So our AR days, I don't have an exact number, but I know they're trending down. And of course, we're going to be looking at that pretty closely in the next year to see really what that comparison has been over this past year. Yes, I would definitely recommend it. We've been very happy with our staff, really like it. They caught on very quickly. So it's very user-friendly programs. Our patients are liking it. The patients' families, we've had really good feedback on the TV screens. We have a fairly small waiting room, and so the text messages that are going out, those are really important for families who are leaving the building and leaving their family member here so that they can come back in a timely manner and be here for us. So then we're timely getting them out because their rides are here and able to talk to them. They all understand that technology is where we're at, so they're not surprised to see us with computers. I think they know we're trying to stay current and help them. So it's been really good. Number one, I would say, is just the ease of use. It is very user-friendly to be just in. Most of us are only in one product per day, so that it's easy to learn, and then you just kind of can do your thing. But even I interact with 3 of the programs daily, and I just find it very easy to go around and update. I really like that we're able to make changes so quickly. With Vision, you had to send off a request, and maybe it would get changed in the next week or so. Here, I'm able to go ahead and make the change myself to parts of the program, or maybe we're missing an assessment somewhere or a discharge instruction. So that's been really nice to see that immediate change and know that we can do that. That's been really good. The customer service has been great. We all have hiccups and things that we didn't think about until after we went live. And it's been really helpful I can call and get an immediate response if it's something urgent. I have had good responses though with the email if things aren't urgent. So that's been really nice to get those resolved quickly. And then I think my third thing was just that ability to change on the fly, adding things in when we needed to. That's been just super helpful that way. I think our day-to-day work has become much smoother. I see everyone looking at the monitors in the pre-op phase and then the OR hallway as far as, okay, where are we at? What's next? Who's where and when? That's been really nice. As a communication tool, having everything at their fingertips. So they're seeing all their documents when they need to and reviewing those. That's been really helpful in the day-to-day process. And then just being able to close charts quicker and have those things set out. So then I know our business office, they're up to date on where they need to be. It's also been really nice with the text messages for the patient and patient's families. Most of the time, yes, things could be done within a couple of days, maybe 4 or 5 days, I would say. And we're probably down to like a 2 to 3 day range as far as the op report being back and some of those main pieces of the chart being done. But as a full, complete chart, I'm being able to get that down way more. Because with paper charting, you would have people miss their signatures. They would miss a date. They would miss just a checkbox that I wasn't doing. So, but when you go to an audit, you notice that they're missing the pieces that a surveyor would see and say, oh, your charts aren't complete. So to me, a complete chart is absolutely everything is done. And those are with the task manager. It's been just so nice for people go in and see where they are real time. So the next day they're like, oh, I missed that piece in my chart. And they're able to fix that right away. So that's been really nice. Goals that we've been able to achieve, I do think our AR days are trending downward because of the chart completion and being able to drop those claims quickly. Clarity has been really nice as far as with the No Surprises Act. I think Clarity has really helped us there to be able to give a real estimate so that the patients know what is expected of them and there are no surprises. So bills are being paid faster, and that's really important to us as well. As far as quantitative outcomes, I do think that our just stationary office supplies are definitely going down because we're not having our paper consumption's got to be at least 20% down, if not more, and more to come as we get used to it and everyone feels more comfortable not printing. So it's just some people like that physical feel of the paper, but they're finding they don't really need it. So that's really nice. I know personally with the anesthesia billing set, that has been that's taken away something I don't have to do every day, because they're able to go in and see what they need to see without me having to physically send them the information. So that's been great. And quantitative, just being able to drop those AR days and bring in the money quicker. Currently, we are still using simple admit, and I know that HST has, since we have been in the implementation process, they are rolling that into their own. So we are very excited for that to start being able to talk to practice management in eChart. And so that'll be another piece that we are not having to input as a document, because it should already be connecting to that. So that's one piece that we're really looking forward to. We're also looking forward to the post-op phone calls going away, that they'll go with a text instead, and with the surveys as well. So I think we only get about a 10% return on our surveys right now. It's really very low. And you're only getting those two extremes. They love you or they hate you. So I'm really hoping that once it's in a text message, I know personally when I get ones from things that I've done, I'm more likely to respond in the text message. I'm interested in seeing that they continue to find these other pain points that other centers are experiencing. I really like that HST, the primary focus is ASC, so they know exactly what we're doing, because we're all truly trying to do the same thing with the same goals and really the same setup. So I'm interested to see what HST, from having that community and hearing from everyone, to see what else can we do. It went pretty well for us. We took about 6 months. There were obviously some hiccups. You always have people who are very willing to change, and some who are a little lower to accept things. I will say we were not able to have anyone on our staff dedicated to the HST implementation as their true sole role during that time. So it did take us a little bit longer, I felt like, just to get over some of the hurdles and make sure that we had everything together. We did do the big bang, as we kind of called it, with everything. So that in itself was a lot, but I think looking back now, we're all very happy that we did it, just because you're not having a big bang all the time. One done and everyone's on the same ride together. I think one thing that kind of an unexpected benefit that I think of bringing HST in the product, just an increase in job satisfaction with some of my staff. I really feel like they have the tools now to do their jobs like they want to do. And so it's great for them to feel that satisfaction. And when they're taking care of the patient, they have everything at their fingertips, that they feel more confident when they're taking care of patients, because they have everything they need as far as information. They feel current and ready, and that's really important.